Hi, Brad Ott from Rebound Sports and Physical Therapy. Here with Lauren today, avid runner. We're going to look at a few biomechanical tests on Lauren that may relate to both performance but also injury prevention. So, Lauren, let's have you hop up here on your back, feet down here. So efficient running has a lot to do with pelvis and hip mobility and stability. So what we want to see in Lauren is we want to see symmetry in her range of motion on right and left sides, because that relates to her running with what we call a reciprocating gait, where the right and left sides are doing mirror images of each other, allows for an efficient foot strike, and again, symmetry. Okay? So let's just check a few of these things, Lauren. First one is her straight leg raise. Tell me when you feel a little stretch there.
Right there.
Okay, so mark that on the ceiling.
Okay.
Alright, tell me when you feel this one.
Right about there.
Okay, and what do you notice about that?
The left is less than the right.
Okay, so she's a little bit more restricted on the left side. Let's go ahead and bend your knees. Okay. And with your feet equidistant apart, let's let this leg fall inward. Good.
Okay.
Note how floppy that is, and then the left one. And what do you notice there?
It's tighter.
Okay. Now, Lauren doesn't have any real pain complaints today, but she is noting that lately she's had a tighter left hamstring, and in her past history are some shin splints.
Yep.
Okay? Interesting that those two tests, both on your left side, were a little bit more restricted, weren't they?
Right.
Alright, let's turn you on your left side now. This is an important biomechanical test that we do on the hip and pelvis. Go ahead and let that drop, Lauren. Good. I want you just to note how easy that drops to the ground. Okay, let's go ahead at this end on your right side. Alright, let's check this one. Good, relax your leg and let it drop. And what do you notice about that one?
It doesn't drop.
Okay, now we've got 3 or 4 things already that are a little bit asymmetrical on Lauren. Kind of interesting there. Okay, let's turn you on your back again, Lauren. If we look at her hip rotation, okay, I can roll this foot in and pretty much touch her big toe to the table. Okay, Lauren, what do you notice on this?
It's tighter.
Okay, again on that left side, all right? As we move to how your muscles are firing or your strength, okay, this little imbalance might affect the way that you're able to recruit some of the key pelvic core hip muscles, okay? On this side, I want you to prevent me from pushing it in. Okay, ready and hold. Good, she's good and strong there. Hold here, ready and hold. All right, hold it hard. Ready and hold. Okay, so Lauren might be thinking that I'm pushing harder on one side than I am on the other, but I'm actually not. And one of the ways we can confirm that is if I ask her, when you push out, Lauren, hold that for me.
Okay.
What muscle are you using?
My outer hip.
Outer hip. Okay, when you push out on this one, push out for me. What muscle are you using?
My quad.
Her quad, okay? She should be feeling her outer hip abductor, okay? But over here we've got some compensation. So what I think is going on with Lauren is that she is overusing her hamstring because of the deficits around your hip. Does that make sense?
That makes sense.
And we have a little bit of a pelvic asymmetry where the alignment isn't quite ideal. Okay? Easily correctable. I'll show you that a little later.
All right.
Okay? Thank you.